Go.
I just had to turn on this whack hospital Wi-Fi.
Yeah, that's why I was saying if the reception in there is terrible.
It is trash. It made it even worse. So I didn't really get to post it. So I don't know how many people gonna come in, but it don't matter. I'll post it anyway when they do come
Oh
in.
yeah, that's fine. Well,
It's
it
been
definitely it's
long.
climbing. The notification just popped up on my screen that we went live too.
All right. Yeah, it's been a ridiculously long day. Ridiculously long. I had hard cases today.
Uh-oh.
They find me.
Well, that's not necessarily a bad thing, right?
No, I guess not. I guess if I beat the drums for them to come, they come.
That's what
Damn,
they say. Bring them out, bring them out.
and they come out. It was nuts today. I had a day. I guess we can get started. Let's
All
go
right.
get it.
All right. Well, welcome everybody. I see y'all joining in and trickling into the live. It is our monthly visit, DocP with me. Thanks for the waves. I see y'all comments today. We're going to go ahead and get started. So if you've been here before, welcome back. If this is your first time joining, I'm Cola Red Bell, and we're joined by Dr. P, the fibroid slayer himself. And basically, I am one of his patients, and I am post-op for treatment for advanced fibroid disease. And basically, ever since I shared my journey on social media, the response was very positive and overwhelming. And we decided to keep some of the patient-doctor consultation going, so other people can visit and ask questions as well. So if you're just joining, we're going to go ahead and get started. So I have some questions that are submitted. You are also able to drop your comments in this chat. So there's at the bottom of the screen, you'll see a question bubble with a question mark in it. If you want to submit a question, you can definitely do it there. And Doc P, if they want to jump in the live, they can request to join?
Sure, if they want to request to join to ask questions, I'm good with it.
Okay, so you got two ways to ask questions tonight.
I'm listening. I gotta grab something really quick. Go ahead.
Okay, so you got two ways to answer questions tonight. You can, I have some submitted. You can put your questions in the question mark bubble, not on the screen, but in the question mark bubble at the bottom. Press that button and add your question. Or you also have a request to join button. So if you want to pop in the live and ask your question yourself, then you can really get interactive tonight.
All right.
So first, I'm gonna start with something that's submitted already.
We should make people hop in anyway. Make it
Yeah, if you have a question, definitely request to join.
I'll let you control it.
Well, it's gonna come to you because you
It is.
host
Oh
it.
yeah, because I put the thing in.
Yeah.
Oh, so you can see.
Yeah, so it's gonna tell you that they want to join.
All right, let's kick it
All
off.
right, so if you get a request, then we'll go to the person requesting,
All
and
right,
then I'll go to the submitting.
Yeah, and I'll come back to you.
Okay. So first question on the list: can you please explain for us what is endometrial ablation?
Awesome. So, endometrial ablation is a procedure. Is typically an outpatient procedure in which a device is used to burn, for lack of a better term, the lining of the uterus, which is called the endometrium. Right. It is a treatment option for abnormal uterine bleeding, with the caveat that you don't have like polyps or fibroids that are pushing into the cavity of the uterus. So The cavity of the uterus is lined, the endometrium lines the cavity or the inside of the uterus. This is where pregnancies happen. This is where everything happens. This is where the magic of the uterus is. So when you have abnormal uterine bleeding, it's because of the endometrium either shedding off irregularly or bleeding abnormally, or there are things that are pushing inside of that cavity that's causing the abnormal bleeding. And ablation just basically burns that thin lining of tissue in there to treat bleeding.
All right. Next question. Is it harder to get pregnant with one tube?
No, it's not. Statistically, it's not. I think it may have a slight statistical difference, but nothing to really speak of. As long as the tube is viable, meaning there is no blockage or fluid or nothing else happening with the fallopian tube, you should be able to get pregnant just as well with that one tube as you can with two. Same way when people have ovaries removed on one side, the other ovary compensates and produces the hormone, so there's not really a drop off. In addition to that, there is the ovulation doesn't change either. So the chances of a woman getting pregnant with one tube is just one viable tube is just as good as a woman that has two. Same way with the ovaries too. So the beauty of having two is almost like somebody functioning with one kidney, right? We donate kidneys because you can function perfectly fine with one kidney. You don't go into renal failure or get sick. You still can be perfectly fine with that one kidney. It's the same way with the ovaries and the fallopian tubes.
All right. Does birth control prevent ovulation? And if so, would it be hard to ovulate after years of not ovulating?
Yes. So the answer to that question is yes. Most birth control birth control options are designed to stop ovulation. Notice I said most, not all. Some birth controls are not just designed to inhibit ovulation. One in particular would be the Paragard IUD or the copper IUD. It is not intended to prevent ovulation, but to make a hostile environment of the uterus so the sperm can't travel up. And if there is fertilization, keeping that hostile environment so there can't be implantation. So, but for everything else like birth control pills, Depo-Provera or the shot, other progestin IUDs, they also can inhibit ovulation, but that's not really their mechanism either. But overwhelming majority of birth control is used to stop ovulation. Now the question is, as far as does ovulation return once you stop birth control? Yes. With all birth control, typically your ovulation will come back. Typically with the short acting birth controls like birth control pills, the patch, NuvaRings, those shorter acting ones, it comes back right away. That's why it's important to take it all the time, right? So when you miss days or what have you, you can ovulate. As well as the IUD. So when you remove an IUD, ovulation returns relatively quickly. The one that doesn't do it as quickly is Depo-Provera or the shot, which would, in some regards, for some women, ovulation can return quickly, but it can take up to a year after getting off of the shot for your body to get back into a regular ovulatory pattern. So for women that have been on Depo for an extensive period of time that are trying to get pregnant right away, we don't really freak out about that as gynecologists. We encourage that you are patient and give your body a time to return to ovulatory cycle. Another thing is that too, people get kind of confused about ovulation. Can you get pregnant without having regular monthly periods? Yes, you can. Just like you can, probably win the lottery by just, looking off somebody's ticket and using their ticket possibly and win the lottery. But it's not very common that that's going to happen, right? Mm-hmm. So you need to have regular periods because regular periods, regular monthly periods that are either, from, a 21 to 35 day time frame period indicates that ovulation is happening. When you're bleeding multiple times per month, or, once every 3-4 months or what have you, typically you're not in an regular ovulatory cycle. And if you're not in a regular ovulatory cycle, then the chances of you getting pregnant are slim. Not to say that you can't, but because people sometimes don't have regular periods and still ovulate. I've had women that have that, but they are in the minority. Usually you need to have a regular monthly period to get pregnant, typically. Somebody be like, he says you have to. No, I didn't. I want everybody. I choose my words. I want y'all to realize I choose my words extremely carefully. So if you try to come from me and say he said or whatever, listen to what I say. I say typically, most, probable, those things. I speak, and when I'm giving these talks, nothing is 100%, right? So, I have instances where I have women that have 15 centimeter fibroids to get pregnant, right? Are they in the majority of women that get pregnant? Absolutely not. You can have fibroids are a major, cause of infertility when they're that large, but they get pregnant. It's exceptions to every single thing. So don't take what I'm saying, everything that I'm saying as he said this. Like, listen to the words that I'm choosing. And when I say it, if you have a question specifically about what I'm saying, I can go into it deeper, but don't take anything as like 100% bare bones and then like want to argue with me about it. Because again, I choose my words extremely carefully if you listen to me.
All right. So if you just join in, you can ask your questions tonight one of two ways. So you can still use the question bubble at the bottom of the screen with the question mark in it. But if you want to join the live and ask your question yourself, feel free to request to join in the live. We're making it as interactive as possible so everybody can get the questions answered that they want. So I do have a question in the chat bubble. If one has a hysterectomy leaving ovaries, can eggs still be retrieved for a future use in a carrier surrogate?
Absolutely, 100%. And I tell patients this all the time. There's more than one way to skin a cat. Just because if you are at a place where you need a hysterectomy, meaning that you have extensive damage to your uterus, whether it be for fibroids or any other reason, or dilated tubes or any problems, and you have to have a hysterectomy, it should always be put on the table, because if you do leave your ovaries, you can always retrieve eggs and still undergo in vitro fertilization, with your own genes. So that is an option that is very rarely even thought about. But as long as you have eggs, or as long as you have ovaries, you can still have your own children. You just don't have a house to keep them in. That's all. You just need somebody, buy somebody else's house, which is the uterus.
All right, another question in the chat tonight. How do I come for a visit? I have one fibroid and I'm 43 years old. I really want to remove it.
So you'll hear more like soon, but in all transparency, I'm leaving my practice, my current practice, and it'll be starting up a new one. So it'll be much more information on that. So in the meantime, I'm trying to finish up some of the surgeries that I promised, and carry over the patients that I've promised surgeries to my new practice, which will take a little bit of time. But I keep my commitments. In the meantime, as far as consultation with me, you can always have, get consultation, whether that means coming, to get surgery for me, or arming yourself with information for wherever you're at or where you live at, so that you can either talk to your physician, or plan out your own surgeries or what have you, and understand your options. Because again, information is vital. Information is key. When you are armed with knowledge, the better your outcomes will be. So I can be, my website is www.docforthestreets.com. You can book a virtual consultation with me where I will break down your history, look at your ultrasounds, look at everything, and break down every option that you have, and look at risk and benefits of everything that you need. But as far as like scheduling surgery with me, that's a process. I have multiple people. I mean, I've countless people that have flew in and had surgery. I just completed one today. Where a woman flew up from down south to have surgery. It took me 5 hours today, but that's neither here nor there. But people come and have surgeries all the time, so it is possible. It is workable with insurances and everything else. So start off with the consultation, and then we go from there.
All right. So I have a follow-up question in the chat bubble about the ablation. So I am 50 and I still am having an every 28-day cycle. What are your thoughts on ablation in my case?
As long as you don't have, fibroids or polyps pushing into the cavity of your uterus, an ablation for you would be the first line recommendation that I would give you. Ablations are great treatment options for patients, especially that are closer to menopause, that are having abnormal bleeding. One thing that I tell people all the time is that there doesn't always have to be a problem for there to be bleeding, right? Most people are like, oh, fibroids are causing me to have bleeding. Well, that's not always the case. Oftentimes it's not the case, because I have 45-year-old women that come in with fibroids that have horrible bleeding. I have 45-year-old women with no fibroids that come in with bleeding. And the thing with that is that the older you get, the more your body is that your eggs or your ovaries are starting to lose production and they're starting to decline. With that being said, if you are in an anovulatory state, meaning that you're not ovulating regularly, your bleeding is typically going to be irregular, and it can be heavy, it can be an issue. And a lot of times physicians will say, oh, well, deal with your fibroids. 80% of women have fibroids. The bleeding is typically not the problem. But a lot of gynecologists will say, oh, you got fibroids, let's treat your fibroids and we'll fix your bleeding. And that's a lie, right? You'll still have bleeding. But understanding where those fibroids at, where they're pushing, if they're pushing into the cavity or not, will dictate your treatment options. Because if they're not pushing in the cavity, chances are they're not causing you significant bleeding issues, and you are a candidate for an ablation. So I would recommend an endometrial ablation for any woman, I would say 35 and older, that's done with childbearing, and has fibroid or does not have fibroids, or fibroids that are pushing into the cavity, and wants a minimally invasive option to treat their bleeding, right? So notice I just said treat bleeding, because that's what an ablation is treating. It's treating bleeding. It's not really treating pain and other issues. It's a bleeding thing. So, but yes, I would recommend it. I would recommend it to my mom, anybody in my family. I would strongly recommend it.
All right. Next question. Are there side effects from continuous use of the Plan B pill? And if so, what are they?
There can be. So there's a misconception about Plan B, right? People think that, oh, damn, I took a Plan B and I'm good. So let's talk about what Plan B does, right? So Plan B does not just prevent pregnancies. What it's doing is it's an emergency contraception that is preventing ovulation from happening. So if you have sex and you take, you're unprotected or what have you, and worry about pregnancy, what you're banking on is that you have not ovulated yet, and that Plan B is going to stop you from ovulating. However, realize that if you ovulated already and you take a Plan B, it's not going to do much good. So people say, I got pregnant, I took a Plan B. Realize that means you already ovulated, you took a Plan B, and it just didn't work. Plan B is not a birth control. It's not something that you are going to continue. You should continuously take. Yes, you could throw your cycles off. You can kind of put yourself in a hormonal imbalance by continuously taking Plan B, because what it is it's just a very, very high dosage of birth control. It's like a birth control pill times 10. It's basically what it is. And it's designed to shoot the levels up of estrogen, progesterone in your body really, really high, so that your brain is fooled into believing that you've already, that these levels, that your ovaries are producing these levels. So therefore, it doesn't shoot a signal down to your ovaries to let your ovaries know it's time to ovulate. So when it's time to ovulate in the middle of the month, it's not to get too technical, but it's this thing called an LH surge, and it's a hormone that the brain produces to get the ovary. It pulses down to the ovary and it triggers the ovary to ovulate. Well, if those levels are high, which is what Plan B already does, it basically tricks the brain into believing that these levels are high. The brain never shoots those hormones down. That LH or that LH surge never hits the ovary, and so ovulation never happens. But again, if the brain has already shot that hormone down there, now we need to start having a conversation about these abortion laws and everything else, and that type of Plan B.
Yeah. All right.
Which is another topic.
Right, a whole nother topic. All right. What is your experience with patients using contraceptive implants like Nexplanon versus IUD, meaning which seems to have less side effects?
I mean, I've seen quote unquote side effects with both. For me personally, all transparency, when my child becomes, hopefully, gets to be a grown woman and be sexually active, she's going to get an Nexplanon. It's easy, it's simple, and I would recommend it first line for someone that has never had babies or never been pregnant before, because you don't have to dilate the cervix or do anything like that. I will say that between IUD and Nexplanon, the IUDs control bleeding better. And the reason they control bleeding better is because they disseminate the hormone directly in the uterine cavity, which keeps that lining really thin. And once that lining thin, that lining is the endometrium. So if you can keep that lining thin and stable, then typically bleeding is controlled better. Not always, but typically bleeding is controlled better. Nexplanon, as far as, I guess, the lesser issue that I would see is that some women, which I have my skepticisms and questions about sometimes, but not a lot, but there is a minority of women that will talk about vaginal discharge, recurrent vaginal infections with IUDs, which typically doesn't happen with Nexplanon because there's nothing in the uterus or anything that, increase your risk of infection. So it's pros and cons to both. I think that they're both equally effective. They're both 99. I think Nexplanon is 99.7. IUDs are 99.6 or something. They neck and neck, but Nexplanon is like percentage points, 0.001 type percentage points higher as far as efficacy from keeping you from getting pregnant. But as far as like side effects and stuff are concerned, it just really kind of depends. Both of them can have possible side effects. But for somebody to say, I don't want no birth control or whatever, and because it could possibly have side effects, my response would be like, there's the side effects of pregnancy too.
Exactly.
Pregnancy has its own side effects too. So, people worry about side effects and stuff all the time about stuff, but damn near everything you do has a side effect, possibly. So it just really, you have to look at the general or the most common things that could possibly happen. And, all right, let's say, for instance, you get Nexplanon and you have slightly irregular bleeding, or, if you get, an IUD and you may get a occasional bacterial infection. Like, those things can be easily resolved. Pregnancy is going to be something that you're going to have to deal with for
A
years,
lifetime commitment.
extensively, a lifetime. So, it's not always a bad thing. If it's not, it's, significantly impacting your health or your quality of life, it's something to think about. It's definitely something to consider.
All right, thank you. So I see a lot of the numbers climbing for joining. So if you're just joining, you have two ways that you can submit your questions tonight. You're welcome to use the chat bubble at the bottom, but you're also welcome to send Dr. P a request to join the live and ask the question yourself. So
Yeah,
you can be
somebody hop up here.
interactive.
Yeah, somebody hop up here and ask a question.
Yeah, don't be shy.
Yeah,
We
don't be
don't
shy.
bite.
Hop on here. Ask for an invite. I'll pop you in here. Oh, somebody did request to join. Hold up. Let me see. I'm gonna pop him in real quick, and I'm gonna pop you back in, Cole.
Okay.
All right. I'll send it to her. What's happening?
There you go.
Hey, how are you?
I'm
Good.
good.
How are you?
I'm good.
Sorry.
So this question is coming from a conversation I had with some friends this past weekend. Pregnant,
Okay.
and she has a hernia. And her doctor wanted to, in the past, this is her second pregnancy, but it's like sticking out really far, and they want to repair it. Do you guys do do OBs do that, or is that
Where's her hernia at? Is it in the umbilical? I mean, is it the belly button, or where is it?
It's belly buttonish, but kind of further down. I know it sticks out really, really bad.
So yes and no. So it really honestly depends on how extensive it is, right? So if it's like and anytime, so just from anatomy standpoint for everybody, she's asking about hernias. So hernias typically happen one of two places. Most typically, they're either at the belly button or they're like inguinal hernias, which are down below, like in your groin. You also can have like ventral hernias, so those are like midline, but ventral hernias could be as small as a quarter, which at the belly button, or they could be as large as a basketball.
I mean, this thing's huge. It looked like a
Right.
baseball.
Right. So that type of fascial defect as a gynecologist in a C-section, the only thing that we would do would be to do like a simple repair and just bring those tissues back together. For somebody that has a defect like that, typically they'll need like another agent, like a mesh agent, to fix that, which we don't do. And in addition to that, you definitely would not want to do at the time of a C-section because it's a higher risk of infection and issues. So I would not, no, as a matter of fact, it's not even that I would recommend or a gynecologist would do it. It would be very much so recommended against to have her C-section and at the same time perform, a hernia repair. She would get her C-section and then come back for a hernia repair to fix that. Now, personally, I fixed small umbilical hernia repairs where somebody's had like, quarter size or $50 size hernias at the belly button where it kind of protrudes out. And then I could just oversew that and do a simple repair there. But usually those are fine when you can do something that's a simple repair. But when you have a large defect, the chances of that breaking down with just a simple repair are extremely high. So it's no point in doing it. And if you try to stick mesh in there, it's just a high risk of infection to do that.
All right. Thank you.
Cool. You are very welcome. Thank you.
Thank you.
Thank you. How do I get out of here?
That is a phenomenal question. I'm kind of like Cola now because
Why you gotta say me? That's what we on.
oh no, I got it.
Okay.
All right.
All right.
You know I had to throw you under the bus. It was somebody else saying,
you always throwing me under the bus. That's all right.
You want me to put them in here or you want to ask a question?
Oh no, go ahead. Go to the next person that wants to actually join.
All right. I'll just request them. Hello.
Hello there.
Hello.
How are you?
I'm good. I have a question. So I'm 43 and I don't have any children. And for, I want to say the last 18 years, I've had extremely painful menstrual cycles to the point where I can actually be actively bleeding for up to 30 days.
Okay.
I've gone to multiple gynecologists. I've had multiple transvaginal ultrasounds, CAT scans, sonograms, everything, and no one can give me an answer. I've gotten several answers where one specialist actually said, well, I think it's because you only have one fallopian tube, which I don't think that's right, but
That's wrong.
I'm not
But
a
yeah.
specialist. I'm like,
No,
okay.
you are correct. That doesn't make
So,
sense. Go ahead.
I mean, and I work in healthcare, so that's why I'm like, I don't think that's right, but whatever. So, the last doctor I went to, he did another transvaginal ultrasound. He said, I think it's because you have a small uterus. I don't think that's right either.
You are
So for
correct.
the
That
last
makes sense either.
the last 2 months, he has put me on Provera. He said that that should actually help with my bleeding time, and it has not.
Okay.
Um, um, I'm debating whether I'm going to take it because I'm supposed to start taking it tomorrow. I'm debating whether I'm going to take it or whether I'm just going to go through it. At this point, I don't think I'm going to have children. I have seen a couple of specialists, and I've actually asked to have a partial hysterectomy just because it affects my quality of life. Like I said, I work in healthcare, and it can be so bad as to the point like last month, I was 2 weeks of just intense pain to the point where I couldn't go to work for 2 days. So I
Hmm.
can't continue to do that. So I'm just looking for like a recommendation. If you think I should
Hmm.
see another specialist, I mean, I'd be willing to fly out to see you to see if you could, come up with any concrete answers because everybody's like taking a shot in the dark as to what they think it could be.
Gotcha.
When it began, I did have a significant weight loss. I had a lap band surgery, and I
Hmm.
lost about 100 pounds at that point. And they said, "Oh, it's because your body's trying to regulate itself." But we're going 18 years, and it's still
So
the same.
did you gain that weight back?
I probably gained about 30 of it back, but I haven't gained all of it back.
So would you be comfortable like telling me like your weight and stuff now?
I think right now, because I have been trying to lose more weight. When I weighed myself a couple of days ago, I was about 378.
Gotcha. So, all right. So you had a bunch of things that I want to get into, and I'm glad you. Thank you for sharing your story. But this will be very helpful for multiple people. So number one, as far as abnormal uterine bleeding is concerned, there are multitudes of reasons that abnormal uterine bleeding can that can happen. Once we do ultrasounds, and I put a post out like right before I hopped on there, so I want you guys to check it out. But the post is basically talking about imaging modality. So you talked about they did ultrasounds, they did CT scans, they did all these things. All you really need is a transvaginal ultrasound, right? So with the transvaginal ultrasound, um, they say that about 35 times. All right. So with the transvaginal ultrasound, it really gives us the information that we need. CT scans are pointless for gynecology. Never really needed. MRIs are great, but they're just very expensive and they're not needed. But ultrasounds are for the efficiency and for the money. Transvaginal, which are the probe in the vagina, are what we need as gynecologists. So from what it sounds like is that you haven't had, when they did your ultrasound, you didn't have any significant fibroids or anything else that was in there structural wise, right? So that leads us to just having abnormal periods. Now, other things that can happen, right? So hormonal causes, so thyroids, prolactin, right? There are different hormones in the body that if they're abnormal. Thank you. So there are these hormone levels and checking those hormone levels. So thyroid, prolactin, and checking out the different hormone levels in your body to make sure that that's not a cause of you having abnormal uterine bleeding is also extremely important. The other thing, and the reason, and I it is physiology, it's facts. Okay.
Doc, your connection, you got to start with your last point again. The
Okay.
connection was breaking
Is
up.
it? Am I back? Am I back?
Yeah.
Yes, you
Okay.
back. You were
So I
spinning.
don't want anybody to take anything that I'm saying offensively. I'm here to help, but I'm keeping, everything from a physiological perspective and real. Okay. Your endometrium, where you're bleeding from, is controlled by two hormones, estrogen and progesterone. Estrogen builds the lining up of the endometrium, which basically is preparing for pregnancy. Progestins stabilize the endometrium, and they also kind of like thins it out. It's like the brick and mortar. So the bricks are the estrogen, the mortar is the progesterone, right? That happens every month. Build brick, brick. Mortar, 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 mortar. Pregnancy doesn't happen. Mortar goes down, bricks fall, you have a period. That is literally what happens in your body. Well, with certain conditions like thyroids or anything that hormonally throws those things off, it can cause the dysregulation of the estrogen and progesterone. One big thing that I see all the time consistently is weight, right? So estrogen not only comes from your ovaries, but estrogen also comes from adipose tissue or fat tissue, right? So what happens is that when you have more weight, your ovaries are producing estrogen, and they're producing progesterone, but you're also getting what's called unopposed estrogen from your fat tissue, right? So that means you're getting a ton of estrogen, and the progesterone cannot keep up with all of the excess estrogen that's happening. So what's happening is you have a bunch of bricks that are getting stacked up, but not enough mortar to keep it stabilized, so that you have unstable bricks stacked up and they just start sloughing off and bleeding. So when you're telling me you have an extensive bleeding, that means there's a significant problem with unopposed estrogen that's happening that's causing you to have bleeding like that. Now, the thing that I'm concerned about is when you have this over an extensive period of time, which it sounds like you have, if you have unopposed estrogen happens for an extensive period of time, that can increase your risk for cancers, most notably endometrial cancer. So if you're having that, the very first thing that I would recommend you doing is getting an endometrial biopsy. So Cola Red got an endometrial biopsy before we did surgery, to make sure that lining is not cancerous. But even if you're not going into surgery, it's a diagnostic tool, because your body gives you signs and symptoms. When your body just starts to bleed uncontrollably like that, it can be physiologic, but it also can be a sign of a cancer. So what I would do is get an endometrial biopsy first. The things that you can do to counteract this, let's pray to God that the endometrial biopsy is negative. Things that you can do. I would not recommend that you just automatically just go get a hysterectomy, because you just don't have to, right? There are things that you could do to help fix this problem without getting a hysterectomy. Number one of those things is weight loss, right? And that's not saying as a crash thing or what have you, but it's saying this is something that not only is helping you for your general health, but it also will help specifically with your problem. I'm not telling you that you got to lose, enough weight to be able to fit in a size 2. That's not what I'm saying, right? What you will see is that small percentages of weight loss will improve your bleeding. 10-15% of your body mass will equal huge dividends as far as your bleeding profile is concerned. In the meantime, what I would recommend doing, as long as your uterus is fine, you don't have fibroids and things like IUDs. So we talked about IUDs for birth control, but IUDs are extremely important in treatment for abnormal uterine bleeding. They release that hormone really, really thin. So remember I talked about the estrogen and unopposed estrogen? Well, IUDs are progestins, right? So they are the mortar to your brick. Right. So there it's actually a treatment for abnormal uterine bleeding for someone like yourself. So there are treatments, like I said. So your IUDs will be one. And also too, like, you don't necessarily have to have a hysterectomy. There's things like an ablation too. So the endometrial ablations that we were talking about in the beginning, that's also a treatment option for you. But if you are looking to have children, right? I don't think anybody should take that away from you. I think you kind of defeated it because you just think it can't happen. But I would say no one should push you into having a hysterectomy. If you are really steadfast and wanting to have, a child, you really need to be really steadfast in getting this bleeding under control, and looking into the option. If you're done with having children or don't even want to, it's like taking out your uterus would be like killing an ant with a shotgun. I don't think you need to do that. There are other things that you could do. There are medications, i.e. IUDs, as well as an endometrial ablation, which is an outpatient procedure that would help resolve your bleeding without doing this big surgery. But if you didn't want to do no surgeries, no medicines, diet and exercise, start losing weight, and you will see that your bleeding profile will improve drastically. Last but not least, I'm going to say it again for everybody, because everybody didn't follow me, but I'm going to say it. When we talk about hysterectomies, partials, completes, I want all of y'all, anybody that listen to me, throw it in the garbage. All right. A hysterectomy is a hysterectomy. That's it. Hyster means uterus. Ectomy, anytime you hear ectomy, it means removal. Thyroidectomy, hysterectomy, cholecystectomy, pancreatectomy. Anytime you hear ectomy, it simply means removal, right? So hysterectomy means removal of your uterus. And when people say partial and complete or whatever, it is not your fault. It is us as doctors. It's our fault, because we've thrown that term around, and that term is not accurate, because people think that, you're taking out parts of your uterus. And no, it's not. Hysterectomy just means removal of your uterus, right? You can have a subtotal or a total hysterectomy. Typically, all hysterectomies are total hysterectomies, meaning that your uterus and your cervix are being removed. When it comes to your ovaries, those are two totally different things, right? People have equated partial hysterectomies with just removing your uterus but keeping your ovaries. That's not the case. Hysterectomy is just a hysterectomy. Removing your ovaries, that's a whole nother part of a bigger portion of a surgery. But anytime you hear hysterectomy, just throw out partials, complete. Hysterectomy just means removal of your uterus. Cool? Did that help?
Yeah, so I think what I'll do is I'll make another appointment with the gynecologist I'm seeing and see if I can do you said the endometrial biopsy.
So you need an endometrial biopsy. That's the first thing that I would recommend. Absolutely.
Okay.
And then looking at more non-invasive options, right? If somebody told you that you're bleeding because your uterus is too small, I want you to pick up your purse and you walk out the door mid-sentence, okay? Somebody told you start bleeding because you had one fallopian tube, I want you to put your shoes on, take your purse, and I want you to leave straight out the front door and tell their ass, shut up.
I mean,
like
I said,
shut their ass up, because
this has been 18 years of these types of answers, and I'm like, this can't be real. Like, you cannot tell me that because my uterus, and I've even heard, oh, your uterus is tilted. You have one fallopian tube. Your uterus is small. I'm like, where are you coming up with this stuff? Like, this is just ridiculous.
Tilted, small fallopian tube. Get your stuff and walk out, because they're going to do you harm. All right, okay. They're going to do you. I promise you. Listen, I can't speak it's almost being in the feds and trying to tell secrets on the CIA. It's certain things I can't say because they'll come get me. But I try to tell y'all stuff without directly telling y'all. It's some horrible ass people out here. Okay, I can't rat them out because I just can't rat them out. But they are bad. They should not be operating on people. They should not be even seeing people from my perspective. I wouldn't send my dog to them, let alone, my mama or somebody in my family. But with that being said, I do this so you can arm yourself with the knowledge to know this person's stupid and I need to move on. You know what I mean? So just understand what makes it, because like you said, you don't know a whole bunch. You that just don't sound right. If you sit back and somebody tell you something, you that don't sound right. Like something ain't right about that. 9 times out of 10, you are correct. That means that
Yeah.
shit ain't right. You know what I mean? So just leave if you get that, and
I
just go ahead.
I think the best advice that I've gotten over the last 18 years from I actually saw a top specialist when I was living in Austin.
Mm-hmm.
His suggestion was just have a baby. Okay, well that will only help me for 10 months, maybe a little bit longer from nursing. But then I got another problem. I don't want a child right now. So
Mm-hmm.
how does that help with this extensive bleeding? He's like, oh, well, then you just have another one. Okay, thanks.
So that means you get your purse. And you walk clean out the front door, because clearly he doesn't have all his brain cells together. So
No, and
Definitely
I will
chalk
tell
up
you,
the deuces on that one.
yeah, I
right.
surely did. I did not go back to that doctor specialist my ass. I was like, you were just horrible. So
Yeah, they out here, man. Like it's some horrible people out here. I want y'all, again, I try to get the people the knowledge to understand when people are quacks, and y'all got to take the knowledge and use it. I try to give y'all as much as I can. I can't just spoon and shove it down your throat. It's here for you to use. Please use it.
Yeah.
okay. Well, thank you so much.
Cool. Thank you
Thank you for jumping
for
in.
being brave and hopping on and divulging your story. We really appreciate it.
No problem. Thank you for taking the time.
No
All
problem.
right, now like the other lady, how do I get off of this thing?
I got it. I think I figured it out.
Okay.
Oh, shit. No, I was about to
All
mess
right.
it all up. Hold up.
Right. Don't delete all of us.
Hold on. That wasn't it. I had. Oh no, I got it. I got it. Bingo. All right.
All right. So do you have anybody else that want to jump on, or you want me to go to a submission?
No, it ain't nobody just jumping on right now. I think that's the two brave souls. If anybody want to hop on and ask questions, as you can see, is interactive. You get more if you hop on. If you're brave enough to hop on in here and ask questions, I'm going to basically give you a personal consultation about how to do it. So that's the gift to you if you are brave enough to do it. So.
All right. This is a good question, actually. And my mom probably gonna watch this, so Ma, I don't be cussing. This is just a question. Is there any alternate prostate exam that they just numb you and you don't have to know that they are in your ass? Because I personally feel like I am willing to just die instead of knowing someone is in my ass. What about the medicine they give women for C-sections and they are woke and cut open and don't know it? Do they have something that can lower the whole lower half man that we can ask for to get the exam too? And how long is a typical exam?
Shit. Okay.
I think that's a good question.
That is a good question. So,
And I think a lot of men think that.
Right. So full transparency, I put my whole prostate journey on display on social media because I believe in being transparent and educating people. And the simple answer to the question, the answer is yes, there is, a blood test called a PSA that can help indicate if someone has prostate issues. However, it's not 100%. It's not, it's not something that's like, all right, if it's low, there's nothing that's going on. There's nothing that really can, at this juncture, counteract a physical exam. So for me, and it really is all about risk and benefits, right? So for me personally, my grandfather had prostate cancer. My father had colon cancer. So as much as I didn't want, I don't want nothing in my ass. I promise you I don't. It gave me the like nightmares to even think about it. However, I did my research. I was like, look, I don't want prostate cancer under no circumstances. So I had to eat that. And what I did was I found my regular doctor is a man with big hands. There wasn't no way that man was sticking his hands on my ass to fill my prostate. So I found me a little bitty Asian lady with super small fingers, and I had it hurt, and it still was uncomfortable and hurt, but it took the mental aspect out of it for me, and I did it, you know. So at the end of the day, you know, you got to be very comfortable in your sexuality, which I am, and I'm more comfortable in the fact that I don't have prostate cancer at this point. So you have to ask yourself, like, is it really, you know, you can do the blood test, but if you want an assurity, you would do the blood test in addition to having an exam as well too. But at the bare minimum, get a PSA or prostate specific antigen with your blood work if you're over 40. But it is recommended, just like women. Women don't want to do mammograms, right? Mammograms are uncomfortable. They're painful, but they do them. Women don't want to do pap smears. They're uncomfortable. They're painful, right? None of us want to do colonoscopies, right? So just like I had to have a prostate exam, or I got a prostate exam, I also had to have a colonoscopy performed because, you know, my father had colon cancer. So with that being said, I got, you know, you got to eat it. Like, you know, it's stuff that happens that you can't really control. So, you know, look, we lost Black Panther from colon cancer at 43 years old. So
Right.
is my fear from this exam, this anal exam, gonna stop me from trying to figure out, making sure that I don't have early detection of colon cancer? Absolutely not. It's just you got to eat that. And plain and simple, just say you got to eat that, because even if you avoid the prostate exam, there's no avoiding getting a colonoscopy, right? There's no
Right.
avoiding getting it. So I got it all like pretty much damn in the same month. I'm just like, we just gonna do all of the anal compromise we're gonna do for this month, and we're gonna call it a wrap for another 5-10 years. And, you know, I'm gonna mentally
Not
forget this
compromise
shit.
for the month.
Yeah, I'm mentally forget this shit before we have to come back to it. So that's what I did, you know. And I say, man, do the same thing. Like, man, get your prostate, get your colonoscopy, go ahead and understand you're gonna be violated for that month, and then just, you know, mentally forget it. That's what I would say.
And they also said, well, how long is the exam? Did you say that? I'm
The
sorry.
prostate exam?
Yeah.
It's nothing. I mean, it's just basically what they're doing is so your prostate is like a little bulb that sits at the top of your urethra. Like, so your urethra is at the end of, you know, your penis. It sits there at the top, and it basically provides like milk and nutrients and lubrication to like sperm and those types of things. Well, if you go through the anus, you can feel that bulb right at the top. It's like a low bulb, right, you know, at the curve of your colon. So they're just going and they're feeling to make sure that there are no hard nodules or knots in your prostate. And they, you know, that's the only way to really physically do it is through the anus. But again, you know, typically, if you have cancer, a prostate specific antigen will go up. However, it's kind of like ovarian cancer, where, you know, if you have an ovarian cancer, typically, you know, the CA-125, which is, you know, a hormone that we check for like ovarian cancer, typically that will go up. However, it doesn't always happen. So, you know, a woman can't just rely on a CA-125 if she has an ovarian cyst, you know, to ensure she doesn't have ovarian cancer. You know, it's all about risk and chances or whatever. You know, some mental things we have to get over, you know, to be safe. And that's one of them. And it's not long. It felt like the little Asian lady was like violating me for like a whole day, but it was literally probably about like 10 seconds. I was like, lady, you ain't take me to dinner. You ain't kiss me. You ain't did shit. You just gonna, this is what we doing? You just gonna violate my whole life out here? No, it take like 10 seconds. It doesn't take long.
No, you should go get waxed. That's a violation on another level.
Ooh, I'll cut it.
I want to file my wax lady on my taxes. I think it's been too intimate. I'm like, we go together at this point. Well, since you said colonoscopy, it is one more question that was related. Is a colonoscopy done while you're sleeping?
Yes. Well,
Do
no.
they and they said, do they examine the prostate at the same time, or are they separate?
Those are separate things. So it really just depends on your insurance and your provider and all those types of things. So colonoscopies can be performed under something called MAC, which is like it's a conscious sedation, where I know some people do a conscious sedation, but a majority of colonoscopies are done under general anesthesia. I personally had general anesthesia where I was knocked out. I don't know what happened, what they did. I just saw the pictures and that was it. I woke up and it was over with. So I don't even know what happened. I don't want to know what happened. I know they had a tube and whatever, and it was done. So usually you sleep. But the colonoscopy and the prostate are not done at the same time because those are two different doctors. So your colonoscopy is usually done by a GI doctor or gastroenterologist, and your prostate exam is done by either a urologist or a family practitioner. So two totally different disciplines, and they're not looking for the same thing. So they're separate.
All right, so we coming up on almost our hour, and I know we try to keep it hours, so when we upload it, it's quick. So I do have a quick one, and this one actually is for me. So we'll end on this note. Cola, I have seen your posts lately, and sometimes you are showing your stomach. Are your scars gone now? That is an excellent question. So I'm the mystery of illusion. So no, my scars are not gone. I think we talked about it before. It take like 9 months for them to fade completely, and I'm only at month 7. They are a whole lot lighter than they used to be. I can get away with wearing high waist stuff and you won't see them. I have on a dress today I will show you, but we trying to keep it a family show, so I can't lift it up. But I'm coming up on my annual, so when I'm at Dr. P office for my annual, I will show what my scars look like now. But like I said, they're fading. Again, if you watch my journey, my fibroids were extensive and large. So I have other patients of Dr. P's that have sent me pictures of their scars. They're not as high as mine. My waist is really, really short. I am only 5'2". So I had a short waist and a big baby fibroid. So my scars are a little bit higher than other people's.
Yeah.
So if you're worried about scars, don't be, because nobody should wait as long as I waited to take care of the issue.
And we're talking fingernail size scars. You know, they're not big either. So it really just depends. It you know, like I said, you know, Cola had an extensive case where, you know, I had to put in more ports or what have you, but some people don't have that, and they have less of these fingernail type scars. So, but at the end of the day, usually they're very, you know, small, thin, and unrecognizable to the point where the only person that knows that you had surgery is yourself.
So you would definitely be able to do your Instagram post with your stomach out.
Yeah.
I can get away with it and nobody ever knows. So thank you for noticing though. So next month we'll be back as usual. Thank you everybody for joining. I think I got everything in the question bubble I could get.
Yeah, somebody asked, do I use glue or staples? I don't use staples. I use sutures that dissolve underneath the skin, and the glue is just for it's just like a bandage for the most part, but I don't use bandages nor staples. It's just stitches underneath the skin that dissolve on their own.
And we definitely are still going to next month. If you want to join yourself and ask your question, we will invite you in. If you still want to be anonymous, we are okay. We don't violate HIPAA. You can put it in the question box. I won't say your name. I got yelled at by a guy that said, don't say it's a guy question, but obviously if you ask,
it's a guy, you tell my prostate.
I mean, it's kind of obvious, but I do try to keep it as private as possible. So anonymous. So, but definitely feel free to next month if you want to join. Be prepared. We will allow people to join, and like I said, still submit questions as always. So
All right.
thank you, Dr. P. We
Thank
appreciate
you.
you as
Thank you.
always.
My
And
pleasure.
I will definitely upload it. He's going to put it on his page, and I will upload it to YouTube. Share with a friend that doesn't have social media that would want to learn something.
Yeah,
That's
this
why we
stuff
do
is
what we
it's
do.
going to be uploaded. This is like I think we hit a lot of great topics. This is phenomenal information. Like y'all gotta please just share this stuff. Like I mean, I say this stuff over and over, but it's like, it's sad. Like when I go and teach surgeries and go all over the country and see it, I still see, women getting, just horrible management and surgeries and treatment all over the country. And it's like, we share some of the silliest stuff. Like we'll sit up and watch TikTok and stuff all damn day, but I can't make everything funny. I can't make everything interesting. Some stuff you just have to just like watch and learn. That's my only advice. Just share it with people that need to see it and hear it.
Yeah, absolutely. And yes, someone said in the yes, Doc P post this live as soon as we get off. It will be on his page. It don't even really take that long. It will be on his page. So you could, if you missed the beginning, you can go watch it back. And like I said, I put it on YouTube just because if there are people that say I don't have IG, I don't have this, we're gonna go live on IG. So I put it on there so other people could watch it. And then people put comments and questions on there too. So that's fine. I keep them all in one spot.
All right, so until next month. But I like the spicing people in. I think that's kind of dope.
Yeah, I thought it was excellent too.
So hopefully more
and
people.
we telling you ahead of time. So if you feel like you want to be prepared or rehearse and be so you could be brave, like I said, it's a no judge free zone. So you're in a safe space with people who actually really care.
Yeah, ain't nobody gonna judge. You're helping them realize that, like, just like with Cola, like, I tell people all the time, like, your issue or the things that you're going through, somebody else is going through it too. So it's like, you shared your story and you didn't help probably thousands of people, just by sharing this, whatever. So people were scared to be able to either ask or learn about it, but you kind of paved the way for people to do it. So same way, like if you got questions, just don't be bashful. Just hop on here and ask them.
Yeah, absolutely.
All right, people.
Thank you. And I appreciate you, and I will talk to you soon.
Absolutely. Y'all be safe. Talk to y'all later.
Take care.
All right.
Bye-bye.